Well, the state anticipates widespread distribution of a COVID-19 vaccine by July. But until the first doses start arriving next month, there is going to be a priority list.
It'll be in the phases and these waves, so that everybody kind of understands where they fall within this timeline.
Utah's Department of Health is rolling out its plans for distribution of a COVID-19 vaccine. Both Pfizer and Moderna have vaccines with strong efficacy, but vaccine distribution is going to go in waves, with people being prioritized. When the vaccine arrives in December or January, only a handful of hospitals will get it. They'll distribute it to healthcare workers and those on the front lines battling COVID-19. It will then go to long-term care facilities workers and other healthcare personnel. By February or March, long-term care facility residents could get it, and then high-risk essential workers. After that, it'll be available to the elderly, teachers, child care workers, those at a higher risk profession. People who can work from home will be the lowest priority. So when will it be available for everybody?
Based on how much vaccine, all of Utahns could receive it in June, May, June, but I still feel confident about that all of Utahns could probably start receiving the vaccine in July timeframe.
It's promising news.
It was similar to a regular flu shot. I mean, there's some injection site pain and a little bit of fever and malaise, but short-lived and back to normal.
Representative Steve Elison is participating in the Moderna clinical trial for the COVID vaccine. He says it's 2 shots 28 days apart, and he now feels fine. What we don't know is how long it lasts.
I went in and got an antibody test several weeks after the second injection, and that came back positive. If it was above 1.1, it indicated you'd had the virus. Mine came back at 8.0.
Lawmakers are getting regular briefings on the pandemic, and they're encouraged by what's happening.
I'm very optimistic, and our society needs hope, and this has given me a lot of hope.
While this is all very good news, the state health department does want to temper it by reminding everybody this is a marathon, not a sprint to the finish line with COVID-19. Until a vaccine is widely distributed across the state, it is still in our communities. The virus is. That means that everybody still needs to maintain physical distancing, limiting social gatherings, wearing face masks, and good hand hygiene. Live on the Hill, Ben Winslow, Fox 13 News, Utah.
Ben, before you go, what's going to happen with the existing public health orders and the holidays?
Well, I just left a briefing that the State Department of Health gave to members of the legislature's Health and Human Services Committee, and we did find out that the mask mandate and some of the existing public health orders, those are expected to be extended. Those were supposed to expire next week, but it appears with the COVID cases the way they are, in fact, one hospital already over capacity right now, that those will be extended by the governor at a news conference tomorrow. We're also expected to hear about the Thanksgiving recommendations, and in that briefing we got a sneak peek, and let's just go ahead and put the graphic up on the screen for people to read. The bottom line is the state health department and the governor recommend that you just don't gather with people who don't live in your home this Thanksgiving. The risk of spread is that high right now. Instead, have family get-togethers on a video chat. Now, they do know that some people are going to disregard their advice and do it anyway, so here's some tips to make it a little more safe. Sick or immunocompromised people, the state health department says just stay home, don't come. Everyone wears masks even indoors, make seating physically distant even inside. Don't pass the plate or the dish around. Have one person serve the food, prepare it masked. If you can eat outdoors physically distant, well, that's even better. Now again, these recommendations and the public health orders, we expect the governor will discuss that at a news conference tomorrow.